Here's something every athlete recovering from an ACL surgery needs to hear. Not every physical therapist knows how to effectively rehab an ACL injury. It's like going to any old doctor off the street for a very specific issue. You wouldn't want a podiatrist working on your brain, right? Just like doctors have their specialties, physical therapists do too, and ACL rehab is one of those areas. So in this video, we're going to break down two big reasons why not all physical therapists are equipped for ACL rehab. Plus, I'll share how you can find the right therapist to help you get back doing what you love. One of the biggest hurdles to proper ACL rehab is the lack of access to specialized equipment that's essential for full recovery. After ACL surgery, your knee's strength and control take a major hit. To get back to playing at a high level, you need to regain that strength, close to 100% compared to the other side. If you don't, not only will your chances of getting back to the field be slim, but your risk of re-injury goes way up. But here's the thing, many physical therapy clinics don't have equipment needed to meet these demands, especially in the later phases of rehab. In the earlier stages, therapists often rely on basic tools like TheraBands or light free weights. These are fine for regaining basic control and initial strength, but they don't provide the resistance needed to simulate the forces you'll face in sports. This progressive loading is key to rebuilding muscle size, strength, and knee stability. Without access to these machines and weights that offer the level of resistance that simulates sport, your therapist can't push your body far enough to ensure you're fully prepared for the demands of the activity. I can't tell you how many ACL rehab cases I've taken over from other clinics where the person's thigh muscles were still severely atrophied even after months of rehab. Imagine despite months of hard work and dedication, there's still little to no visible progress, all because they didn't have access to the right equipment. Dynamometers are another critical tool. These devices allow therapists to measure your strength and ensure it's symmetrical between your injured and uninjured legs. Symmetry is vital for preventing further injury and making sure your knees are strong enough to handle sports movements. Without this tool, therapists can only estimate your strength, which isn't ideal when precision is needed for safe, high-level performance. And let's be honest, calling it an estimate is being generous. If a therapist is trying to gauge your strength by simply having you push into their hand, they're guessing. This lack of accuracy can lead to misjudgments and compromise your recovery and increase your risk of injury. Force plates also play a huge role. These tools assess how your body reacts to jumping, landing, and other dynamic movements, simulating what your body will go through when you go back to sport. Without force plates, therapists miss key data that can reveal areas of weakness or imbalance, potentially putting you at risk for re-injury when you return to sport. So if your therapist doesn't have access to these tools, they're limited in how far they can take you, especially when it comes to high-demand, sport-specific movements. This gap in resources can slow your recovery and make it more difficult to safely return to sport. So if you're recovering from an ACL surgery, I suggest seeking out a therapist who has access to specialized equipment necessary for recovery. Don't hesitate to ask potential therapists about the equipment they use. Sufficient ways to load your injured knee and track your progress is non-negotiable if you want a rehab plan that prepares you to return to sport. Keep in mind that not all clinics are the same, and having access to the right equipment can make all the difference in your recovery. Rehabilitating an ACL injury is far from a one-size-fits-all process. It's both a science and an art that demands specialized training and experience. Unfortunately, not all physical therapists are equipped with the expertise needed to navigate the complexities of ACL recovery. For starters, there are significant knowledge gaps that can directly impact rehab outcomes. Understanding the differences between graft types and their unique healing timelines is essential. Each graft requires a tailored loading protocol to ensure proper healing without risking re-injury. A therapist unfamiliar with this may apply the wrong approach, stalling in recovery or making things worse. On top of that, knowing how to progressively load the knee using biomechanical principles is crucial to restoring strength and functionality. Without this knowledge, recovery can plateau or risk of overloading the knee too soon, which can cause re-injury. Then there's the practical side of things. Not all therapists have the hands-on experience to support an athletic population, and this is where things can get tricky. If a therapist primarily works with general orthopedic patients, they may not understand the demands of athletes, especially when it comes to high speed, agility drills, multi-directional plyometrics, and sport-specific movements. This is a huge gap because these exercises are essential for getting back to sport. And what's really important to understand is that return to sport readiness involves more than just physical strength. It also includes psychological assessments, strength symmetry, and hop tests to make sure your knee can handle the demands of your sport. Without the experience of implementing and interpreting these tests, therapists may either clear you for sports too early or hold you back from returning when you're actually ready. And the one-size-fits-all approach simply doesn't work for ACL rehab. Athletes have individual needs based on their sport, position, and personal goals. Rehab needs to be customized to match these factors. If your therapist lacks the expertise to personalize your plan, it could leave you underprepared for the challenges you'll face when returning to your sport, or even put you at risk for re-injury. When looking for a physical therapist to guide you through ACL rehab, it's important to ensure that they have the right experience. Start by asking, how many ACL rehab patients do you work with in a year? This gives you a sense of their experience with this specific injury. You can also ask about their athletic background, like, do you have experience working with athletes, particularly at a high level? This ensures they understand the unique demands of athletes in recovery. So when it comes to your rehab, don't settle for just any therapist. Take the time to find the one who has the right tools, knowledge, and experience to support you through every stage of your recovery. Remember, the road to full recovery isn't just about getting back to your daily routine, but getting back to your sport stronger and more resilient than ever. So seek out those with specialized knowledge, and most importantly, invest in the quality of care that will help you achieve the best possible outcome. If you enjoyed this video, make sure to hit that like button. It goes a long way in helping our channel grow so we can continue providing you with the key insights you need. And subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.